Hey y'all, hey, it's your girl Nurse T coming to you with part 2 of my nursing courtesy video, nursing courtesy 101 video. So if you haven't already seen part 1, I advise you to go see that one first. Go see that video first, and then join me, because this is the wrap up of the part 2 of nursing courtesy 101. And if you like these type of videos, let me know. If you found this video before you found part 1, my name is Nurse T, Nurse T15. I am a registered nurse. I am a RN, BSN nurse. I currently work on a oncology med-surg hospice unit, and in this video I'm talking about like the most frequent things that I see that can kind of affect you, the start of your day, and not only that, how this also affects the patient. So this video is pretty much guided to those of you who are maybe going to be soon graduating from nursing school, or if you are a brand new nurse and getting ready to start, you probably in orientation, you know you're about to hit a med-surg unit and you just want to hit it running, right? Or if you've probably been a clinic nurse, maybe you've been working like maybe in an infusion center, a clinic, home health, and you feel like, okay, I think I want to get back into the hospital setting, I think I want to join a med-surg floor. Then these are some things that Nurse T15 have been seeing, and thought I'll bring it to the forefront so that you can better help other nurses, and hopefully other nurses that are seeing this can better help the next nurse coming in. So I did a few things on the last video, but I'm going to go over a few more things on this one. So my next thing to do is, nursing courtesy 101, is if you have 4 a.m. labs and you draw 4 a.m. labs, or if you draw 4 p.m. labs and you know the night shift about to come on, or whatever time, a.m. or p.m., if you draw labs and one of those labs is a CBC, complete blood count, with that particular test, it's going to go over certain labs that can affect the patient to where they need treatment behind it. So let's say with the CBC, you get it back and then the hemoglobin is 6.0, okay? So at my institution, if it's lower than 7.0, that means they're going to pretty much be getting a blood transfusion. So if this patient came in for anemia, bleeding, this and that, then a person probably kind of expect, okay, that's supposed to be some blood. If the patient level is a 6.8 and you know that they're going to be transfusing, and you work the night shift, and you're kind of afraid to be calling the doctor, or that sometimes they have a nurse practitioner on call at the hospital, so you don't have to bother the doctor, and they ask you to transfuse blood, and you find out that the patient needs a blood transfusion, and you wait, and if the doctor, especially if the doctor tell you to put an order in, but if you wait because you know that the results you have is going to require you to do a blood transfusion, and you're like, I don't want to do it on my shift, and you purposely hold off on letting the doctor know, you're wrong. So that kind of stuff can affect the patient's life, and I've seen it where a person did not want to start a blood transfusion, so they purposely held off on starting the blood transfusion to allow the next shift to do it, and it wasn't a pretty picture. Let's just say that it was not a pretty picture, because at the end of the day, patients can suffer. So if you know that you have labs stating that you will be pretty much drawing a blood transfusion, administering a blood transfusion, please at least start it, or initiate the typing screen or something that'll help the nurse shift off that's coming in. Also, I often see this in, nursing courtesy. If I come in and I see that I have, a patient that has a hemoglobin the day before of 11.0, and all of a sudden, if they have a hemoglobin of 11.0 and all of a sudden I come in and it's a 6.8, patient have not been bleeding from anywhere, patient have not seen blood in the stool, patient just all of a sudden have a drop in the hemoglobin. And I go in and I ask, so how was the blood collected? Did you do a peripheral stick? Did the patient have a lot of fluids going during that time? Did you use the arm where the fluid was going? Because that can be pretty much hemodilution. That means all that fluid you've been giving that patient got mixed in with the hemoglobin, and it diluted it, which gives a false number. So out of courtesy, I usually would ask the patient, are they okay with me re-sticking them? Because 9 times out of 10 they have not been stuck from the beginning. They typically get it from the IV. Getting certain labs from the IV, if it's okay per your institution, that is fine. But majority of the doctors will tell you, please do a peripheral stick when it's time to draw a complete blood count. So if I come in and I see that 5 of my patients are needing blood because you pull blood from everybody's IV, not the PICC line, but the peripheral IV, and you did not go in and stick the patient to get the blood, so this patient now has a false level, and sometimes it could be an accurate level, but I'm just saying, just make sure that you follow all steps if you're going to do it that way. So it can avoid false numbers, okay? The next thing I would say, and I'll wrap this one up. Like I said, if you haven't watched the first video, watch the first video, because this is the tail end of this one. But the next thing I would say, and you know, I don't want to step on any toes on this one, because I see it, and I know everybody's not the same. Maybe it's just me. Maybe it's just me, your girl Nurse T15. It's just me. It has nothing to do with patients, pretty much. But I'm just going to share this because this is what my patient told me. My biggest thing is, when I go to work, I'm not saying you have to beat your face. I'm not saying you have to go put all your scrubs in the cleaners and do all of this stuff. But all I'm saying is take some pride in how you come to work. I've seen some people come to work with some rugs on their head, hair looking like carpet, and it's like they don't even care. Scrubs are dirty. Odors. Dirty shoes. Smell like cigarettes. Smell like alcohol. If they took a bath, sometimes you wouldn't even think they did. And I mean, you know, and I'm not saying this to be cruel or mean, but you know, sometimes you have to just self-check yourself. I feel like people, you know, they respect you better when you put just a little bit more effort into you. You know, making sure your hair is neat, making sure your uniform is neat. Like I said in another video, I had a patient that smiled when I came in because he told me, he was like, I like to see nurses that look like they care for themselves. You know, I mean, as you can see on my videos, like I like to make sure my hair is maintained. I like to make sure, you know, I don't have the most perfect skin, so I'm not gonna just walk out the house looking a hot mess 99% of my time at work. If you catch me there one day or two, you caught me. But other than that, you know, take a little pride in yourself. Not only that, even the doctors, like I even noticed, they even smile at you more, especially if you young, girl, you young, and you trying to catch them, cuff them. You want to cuff you one of them doctors, you better keep yourself together. So no, you don't have to go, like I said, you don't have to wake up an hour early to do all this stuff. Me, I wake up 10 minutes early, and you know, just show that you care a little bit. After all, it's your profession. It's your profession. Some patients look at you a certain way. If you work for a rinky-dink hospital, a rinky-dink facility, rinky-dink whatever, but if you're going to be working in a top-notch hospital, a Fortune's hospital, whatever, they want to, those patients, a lot of those patients are like, you know, high caliber patients, and they don't want to, sometimes they kind of lose that trust in you just by judging you when you first walk in, you know. And for some of them nurses who know what I'm talking about, sometimes we get judged, period, when we walk in. So until we open our mouth and start talking, and then they see, okay, yeah, this girl knows what she's talking about. So my thing is, Like I said, you know, this one can be just one for the books. It's not one that's mandatory, but hey, let's just make sure that, especially women, you know, we're taking a little pride in ourselves, you know. But I'm gonna go ahead and wrap this video here. I do have to go get my cleaning. The dogs are barking, literally. So my daughter and I are about to go get our cleaning update. Our cleaning and our tightening. So I'm gonna go ahead and get out of here so I won't be late for my next appointment.